Austin's top doctor is warning stricter COVID-19 guidelines could be coming, even a city curfew. Good evening, I'm Robert Hadlock.
And I'm Sydney Benter. It would be the area's first time under Stage 5 restrictions.
KXAN investigator Kevin Clark looks at the extra precautions the city is considering and why there are limits.
Certainly.
Frank Wong won't be traveling to see family this Christmas. His longest trips are the occasional walks he takes outside.
It's very, very hard to fight this urge to want to be out, but I stay in pretty much most of the day.
He says he strictly obeys COVID-19 health guidelines, but has less faith in those around him.
But it makes me concerned because for the most part, if you look around, people don't wear masks.
Austin's top doctor appealed to the community to tighten up its behavior, with our area's 7-day hospital admission average as high as it's been since July. Dr. Mark Escott said most projections have our area entering Stage 5 guidelines by the end of the month, others by sometime next week. We've never been in Stage 5, but last month the city lowered the threshold over concerns of not enough hospital staff. Escott said Stage 5 recommendations could include eliminating after-school activities, discouraging dining in, or even a curfew.
And we simply cannot take the risk of having a substantial catastrophic surge.
A spokesperson tells us the city is still determining whether it would close parks, city golf courses, or other public areas. She added a COVID-19 forecast isn't set in stone. It can change with the community's behavior. As of right now, though, a number of models project our area could still be under Stage 5 during the second week of January, when the Texas legislative session begins.
I think people are likely to gather, and if this indication of what we're seeing following Thanksgiving, is true for what we see following Christmas and New Year's, it could mean really troubling trends over the next few weeks.
Kevin Clark, KXAN News.
As far as restrictions go, the city and county have limited authority. For example, business openings and closures are determined at the state level. In October, Governor Greg Abbott said capacity limits on businesses would only change if 15% of hospital patients have COVID-19. We haven't hit that threshold, but many areas have, including El Paso, Amarillo, Dallas-Fort Worth, and Waco.